available from WHO, World Health Organization, or from Caribbean Public Health Agency. So for further information on COVID-19, we can visit the social media outlets or social media pages of the Ministry of Health, so the St. Kitts Health Promotion Unit on Facebook, on Instagram, and also on YouTube. Or we can just call 467-1172 or 467-1108.
The symptoms of the coronavirus are similar to those of the common flu or cold, which are consistent coughing and sneezing, fever that does not go away, and difficulty breathing. If you are experiencing any of these symptoms, it is advisable to stay at home until you recover, or if you want to go to your doctor, call first and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that people most likely to be at risk if they contract the virus are persons over age 60 and persons that have an underlying medical condition such as hypertension, diabetes, kidney disease, or a respiratory condition. It is advisable to avoid large crowds or other places where you might have to come in contact with people who are showing signs of the coronavirus. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes
Good afternoon and welcome to the National Emergency Operations Center COVID-19 Daily Briefing. Thank you very much for joining us for this briefing, where we provide you with relevant information, up-to-date information as to what is happening in St. Kitts and Nevis with respect to the COVID-19 pandemic. Today, we have quite a number of presenters which you will hear from. And of course, at the end of the presentations, the press is invited to submit questions. First, we are going to have members officials from SAGICOR, the nursing fraternity, and the police. So I would call from SAGICOR Mr. Denrick Connor, who is the agency manager, Terencia Gums-Williams, who is financial advisor at SAGICOR, Mrs. Kerry Williams-Tuckett, who is the matron at the Joseph and France Hospital, Mrs. Sandra Lestrade Keynes, who is Assistant Director of Institutional Nursing Services, and Assistant Commissioner of Police, Adolph Adams. Yes. Yes, come.
Good afternoon, all. Sagicor is very pleased to join in the fight against COVID-19 here in the Federation of St. Kitts and Nevis. In acknowledgement of our corporate social responsibility, we have identified two groups of first responders to which groups we shall be making a considerable contribution in this fight. And so I call first on a representative from the police force. We have acknowledged the police force as a first responder who will receive a presentation from Sagicor. No, I should. And next we call upon a representative from the nursing fraternity who is out there every day risking their lives to keep our federation safe. We invite someone from the nursing association, the nursing fraternity, to come and accept our gift, our presentation to you in the fight against COVID-19. Again, we must thank the police and the nurses for being on the front line, keeping this federation safe in these trying times. Thank you so much.
Okay, thank you very much for your presentations. I now call on Mr. Andrew Satney, who is the president, the executive director, of the Chamber of Industry and Commerce. And Mr. Satney, of course, will speak to us in terms of the importation of food and food security and that sort of thing.
Thank you, Mr. Williams. Good afternoon, everyone. Let me just see how pleased we are for joining the COVID-19 task force, the government of St. Kitts and Nevis, and everyone who is doing the good fight for inviting the St. Kitts and Nevis Chamber of Industry and Commerce for this briefing this afternoon. Let me just say at the onset that the Chamber has been working very closely with the COVID-19 task force for a few months now. In fact, we invited the task force to the Chamber a few weeks ago to speak with all of our members about the virus, what's expected of them. Discussions included business continuity, the issue of educating the workers as well as the customers and so on. So we started that a while now. And we have been continuously working with Mr. Samuel and his team right through the process. And let me just add, with regards to one of the actions that we take very seriously is the issue of ensuring that there is food supply for the people of the Federation, whether imported or local. With relations to local, we've been working very closely with the Ministry of Agriculture on the whole issue of the availability and scheduling of crops. With regards to import, as you know, we import over 80% of our foods into the Federation. So the Chamber has been working very closely in addressing the logistics. For example, how functional will the Customs and Excise Department be? And we've been working very closely with senior management of the Customs, just to ensure that our members know that the Customs will be working right through the process, and also with the Ports Authority of St. Kitts and Nevis. So they have given us the assurance, for example, that right now we have our curfew situation, but the ships with the cargo will be coming in, and they will be cleared by Customs and the ports. The security forces will facilitate the process of ensuring that the containers can leave the ports, go to the compounds where they belong to the different companies. At the same time, Customs has reminded us consequently, and we've just had discussions, and our shipping companies have had their discussions with their suppliers out of the United States that although there was an announcement by the mayor of Florida, the governor of Florida, that they're taking some serious actions with respect to closing down operations over there, the ports in Florida are considered essential services, so the ships will be sailing out of there to St. Kitts and Nevis. So there is no need, as we have been told by the importers, the major importers in the Federation and distributors, for people to panic. We urge people to be calm, and we encourage them to buy the essential things that they need. Try to avoid binge shopping, and people the kind of people have certain habits, and they like to operate when if they see everybody piling up in one store, a whole set of people comes there. So if there's a long line, a lot of people will come there. So we urge people to kind of work very closely with the supermarkets and distributors in ensuring that everyone can have access. And also, we think and we want to compliment the security forces for the work they do in helping to ensure that there's not much congestion and confusion. We in the Chamber, our members have put in place certain systems with regards to how they operate inside the supermarkets or inside the stores. And we thank the persons, the general public, who have continued to adhere to what is required of them when they enter the stores, when they enter the supermarkets, maintain the social distancing and so on, just to ensure that we can prevent the chances of the spread of this COVID-19. I'd like to thank again for the cooperation of everyone who tries to make this effort at ensuring that food is available for everyone a success in the Federation of St. Kitts and Nevis. Thank you, Mr. Williams.
Thank you, Mr. Satney. Of course, I don't know how more often it can be said, but you see a lot of panic buying still. There's a lot of panic buying. People, it's almost as though they hear that we are going to have a famine, and so they're panic buying. There's no need for it. I now invite Mr. Adolph Adams, Assistant Commissioner of Police, to give us an update with respect to law enforcement. Mr. Adams.
Good afternoon. My name is Adolph Adams, Assistant Commissioner of Police with responsibilities for operations. The Federation has been on lockdown from Tuesday 31st March, from 7 p.m. on Tuesday 31st March to 6 a.m. on Friday the 3rd April 2020. During that period, officers were out in their numbers, and as a result, we made a number of arrests of persons who breached their curfew. 12 persons were arrested in District A, 6 persons were arrested in District B, and 3 persons were arrested in District C in Nevis. I would also like to take this opportunity to inform those of you who have loved ones that you would want to lay to rest, you can do so tomorrow. Please ensure that you adhere to the social distancing, and a maximum of 10 persons would be allowed to be at those ceremonies. Also, you will be allowed to do the same on Wednesday. The curfew has drawn on the resources of the law enforcement, and I am pleased to report that we are weathering the storm well. We will not allow opportunities to go to the supermarket or even to purchase essential items, but I just like the general public to know that we were out there in our numbers, ensuring you who remain at home remain safe. Oh. When? I would like to inform also the general public that essential workers are allowed 2 hours shopping period between the hours of 8 a.m. to 10 p.m. each and every morning that the curfew has been lifted. I would like to also inform the general public that you are advised during the lockdown to remain indoors. We don't want persons to be traversing back and forth during this period. This is a time when we would want to prevent persons from endangering themselves and contaminating other persons who are in their homes. As law enforcement, we have a responsibility to protect the general public, also to protect ourselves, and so we will be enforcing the law without any toleration to persons doing what is not required. I would like to say to those of you who behave like you have lions or alligators at home and cannot stay in your home, the police will be out there in their numbers, and we will enforce the law, and you will be arrested if you are found breaking the curfew. Our job is to protect our citizens. Our job is to protect the most vulnerable, the elderly amongst us, and so we will be out there in our numbers enforcing the law. We would want to encourage you during this curfew period to please stay indoors. During the past 2 lockdown days, I would like to commend those of you who paid special attention to the announcement and decided to stay in your homes. You are the true soldiers in this fight, and I want to say, if you keep it up, we will win the war together against this COVID-19 virus. That we know it is easily spread from person to person. We are also encouraging each and every person while outdoors, and we are not saying that you must be out there, but if you have an opportunity or reason to be outdoor, please wear a mask. The Royal St. Christopher and Nevis Police Force and the St. Kitts and Nevis Defense Force will stop and search any vehicle and inquire as to the purpose or the reasons why you are out on the road. If you cannot justify or give any good reasons for being on the road, I can assure you that you will be arrested. Based on the numbers that I reported earlier, the 21 arrests, I think that is pretty high. And so we will do everything in our powers to minimize persons being out there on the road. As persons contravene or fail to comply with the regulations, which they shall be liable and some with conviction of a fine not exceeding $5,000 or a term of imprisonment for a term not exceeding 6 months, or both. I like the both, because in a situation like this, I would want to encourage persons to stay at home. Today, we had an arrest in the curfew, and we wanted to allow persons to come out and to replenish their essential items, their foodstuff, their medication, and so be it. It was a difficult challenge on the security forces, because a lot of persons are still doing panic shopping, and we would want to discourage you from doing panic shopping. panic shopping is dangerous. Dangerous in the sense that we have to limit what we purchase. We have to limit spoilage. We have to make sure we do not overspend. And from what I saw this morning, a lot of persons were engaging in wrong shopping. We saw persons buying stuff like snacks. I'm not saying that you cannot snack, but you don't know how long this pandemic is going to be out there. And so I want to encourage each and every one of you to limit your spending. Save your money for when it is really needed. You're going to reach a time where you're going to wish you didn't spend so much money on foods. I'm a person who don't drink, and also I would say on alcohol. This is not the time to be doing wasteful spending. And I would want to encourage the Federation of St. Kitts and Nevis to adhere to all the announcements that are being made. These announcements are being made for your own safety and your own security. The Royal St. Kitts and Nevis Police Force, we intend to be the last man standing because we have a duty to protect our federation. If you are caught on the road, I can guarantee you, and I can say this without any fear of contradiction, you will receive the long arm of the law and you will receive the full force of the law. We will go to whatever extreme it takes to protect our federation, to protect our people who put us there to protect them. So I would want to say, please, again I repeat, please stay at home, stay indoors. I thank you.
Thank you, ACP Adams. I heard you speaking there about alligators and lions. I have never seen an alligator here in St. Kitts. I have never seen a lion here in St. Kitts. I can assure you we don't have those animals here, sir. So it has to be that you were speaking figuratively, not literally. I now invite Dr. Marissa Carty, who is the Public Relations Officer at the Ministry of Health, to give us the St. Kitts and Nevis COVID-19 situation report. Dr. Carty.
Thank you, Mr. Williams. Pleasant good afternoon to everyone. At this time, as of Friday, 3rd April, the WHO reports 972,640 cases of COVID-19 with 50,325 deaths. At this time in the Federation, our confirmed cases still remain at 9. Unfortunately, the rest of our national statistics are still being updated. As soon as they are available, I will share them with the public. We are asking the public to be reminded, however, that persons in quarantine are required to stay indoors and not to come into contact with any other persons. Persons in quarantine are there for 14 days and will be advised as to when they are able to leave. Please remember to adhere to our social distancing regulations as well as proper respiratory hygiene. Thank you so very much.
Thank you, Dr. Carty. I now invite Mr. Abdias Samuel, who is the head of the COVID-19 National Task Force and the National Disaster Coordinator at NEMA. Mr. Samuel.
Good afternoon, everyone, and thank you, Mr. Williams. Greetings. I am Abdias Samuel, National Disaster Coordinator and Head of Operations here at the NEOC, that's the National Emergency Operations Center. As established previously, these daily briefings are designed to provide you with timely and consistent updates to the public. Our combined fight against combined fight against COVID-19. We will continue to partner with the media, our critical stakeholders, to ensure that at this forum, your subscribers remain informed about the crisis and the progress we are making. some acknowledgements. I want to acknowledge at this time the Sandy Point Benevolent Society in St. Kitts and in New York for reaching out to us and offering to assist with resources. We have agreed that we will do some consultation with our partners, including the first responders, also the Ministry of Health, and we will get a list together and send it to them. I also wish to acknowledge our volunteers who are working on the COVID-19 hotline. I also wish to acknowledge all the security forces and all of our partners who are supporting the operations in the NEOC. Importantly, we also wish to acknowledge FLO for the commitment they have made to providing devices to help the health operations and also the NEOC operations. I also wish to acknowledge what we saw today, the handing over of some nice white envelopes to the Royal St. Christopher and Nevis Police Force and to the nursing fraternity by Sagicor. We welcome the corporate partnership that are happening, and we invite other corporate partners to continue to support the fight against COVID-19 in St. Kitts and Nevis. Again, all activities related to the national response continue to be coordinated at the National Emergency Operations Center as we stand to support the Health Emergency Operations Center, and also it is wise for the general public to know that the Emergency Operations Center in the Nevis Disaster Management Department is also functioning and operational in supporting the Health Emergency Operations Center on Nevis. I will continue with the updates in terms of calls. At the NEOC, we have received six calls for the past 24 hours. One call was health-related. One call was requesting for exemption during the curfew hours, and 3 general information calls. We also had one of the calls was challenges where persons were facing at the supermarket. As ACP Adams explained, because of the rush, everybody was given some liberty. We would have hoped to see some more social distancing practices, physical distancing practices. However, in our natural human nature, we would have seen some challenges being faced in these areas. Again, let us be mindful, and let me remind you that we are in a pandemic. We are in a crisis where we are being faced with a pandemic. I have never faced a pandemic in my life, and I think most of you may have not. It requires a change in our norms. Again, I'm asking you to adhere to the advisories that we are giving you. I want to commend the Quarantine and Isolation Task Force, headed by the Comptroller of Customs, Mr. Kennedy De Silva. They have been doing an excellent job. For the operations for the past 24 hours, they have been focusing on St. Christopher B, which is Challengers, Old Road, Virtuals, and Halfway Tree, and St. Christopher A, Half Moon, and The Village. They have served over 150 notices, which I think is a commendable job for the job that they have been doing since Monday. Again, we're asking persons who are in quarantine, persons who are in isolation, to conform with the protocol set before you. You have signed the agreement, and if you have love for country, you will do your best to minimize the spread and containment of this virus. As ACP Adams said, we are not going to spare any type of effort to ensuring that the full extent of the law will be applied to those who violate. However, again, I would more lean to you exercising your civic responsibility and ensuring that you remain indoors, shelter in place, and conform with isolation and also quarantine protocols. The social services continue to prepare emergency packages for the vulnerable. I want to thank PS Janet Lewis and her team. They did an excellent job today in ensuring that they get supplies to reach out to the elderly and the vulnerable. It's a commendable job that they are doing. The Red Cross has informed us that they will support with psychotherapy and social support with a train of cadres of volunteers. So they have a cadre of volunteers who will be providing us with psychotherapy and social support in the fight against COVID-19. Today, I witnessed for myself, being on the ground, the security forces working hard in enforcing social distancing measures and physical distancing at supermarkets. Again, we made a plea, the Honorable Prime Minister in his address made a plea for persons to remain at home, stay at home. If there is not a need for you to come out of your home, the message to you is stay at home. We are dealing with a very contagious virus. Its infection rate is very high. We are seeing what is happening in other parts of the world. Our objective is to ensure that we flatten the curve. And by flattening the curve, we will ensure that one death is one too many for us here in the Federation. The security forces are going to remain vigilant in enforcing the curfew regulations. We must commend them. Again, we must also caution you that the full extent of the law will be brought down on you to protect our citizens and residents alike. I want to remind the general public that the Chief Medical Officer has reiterated over and over to protect yourselves and others around you. She has recommended that you wear a mask. The question has been asked, if you don't have a mask, and you heard the Attorney General, who is the Mitigation Council Minister, passionately informed yesterday that we have to become innovative. So become creative and protect yourself. Ferries should not be operational at this time. We have received information that some ferries are in operation, and the COVID-19 Emergency Powers Act has stated clearly that the ferries should not be in operations. We met with the ferry operators. They were very supportive in ensuring that we do the necessaries to protect them and their customers. So at this time, we are asking all ferry operators to comply. In conclusion, I want to thank everyone who has presented today. It is also important for me to note that while we look at the numbers of positive confirmed cases that we have, it is also necessary for you to look at the negative results that we also receive, and we get more negative results than positive results. That is hope, and we must have a level of hope. Again, I wish to thank everyone, especially the frontline staff right now, which includes the health, customs, immigration, the police, defense force, and everyone who is partnering with us. However, our biggest partner has to be you, the general public. Again, I want to thank ZIZ. I also wish to thank Sugar City FM, who actually supported me this morning in appealing to the general public via radio for them to exercise caution and stay at home. But if you came out, that you would practice social and physical distancing. I also want to acknowledge Mr. Andrew Satney, who from day one has partnered with the National Working Group in ensuring that the business sector do the necessary things to ensure that they are committed to the fight against COVID-19. With that said, I want to thank you for tuning in to this briefing today, and we are going to welcome your questions. Thank you.
Thank you, Mr. Samuel. Before we go to the question, somebody WhatsApped me and said, they were quite pleased with ACP Adams because he said the supermarkets will be open from 8 to 10 p.m. He has given them extra time, but the supermarkets are open from 8 a.m. to 5 p.m. Daily. It's not 10 p.m. You don't want to be able to do more panic shopping. It's now time for questions. I have a few questions here. One of them is, this one is from Von Radio. Is it possible to name the quarantine facilities designated by the government? And secondly, the second question, for the record, how do the health authorities determine who should be tested? Because logically, the authorities cannot test everyone in St. Kitts and Nevis. Clarification would be great. Those are two questions. There is a third one from Jason Davis at ZIZ. What are the chances of someone who was caught and recovered from COVID-19 being reinfected? That's another question. Dr. Carty?
Okay, first let me respond to the question about the recovered case. The data at this time is not clear as to whether individuals who would have shown symptoms before and the symptoms seem to have gone away and then show symptoms again was actually a case that recovered and then was reinfected. So we cannot really say that that person recovered and then was reinfected. The data is not clear on that. However, here in the Federation, what we are doing in our case, persons who were in isolation, confirmed cases, once they are no longer showing symptoms, they are asked to remain in quarantine for a further 14 days, and they will be monitored during that time. So that's for that question. Now, as it pertains to, I think the other question had to do with, Mr. Williams, can you remind me?
Quarantine sites.
Okay, that answer will be given by the NDC. And the other question?
Yeah, the other one was,
Oh, right, yes, okay. So the other question had to do with the protocol for testing, correct? So in the Federation, our protocol for testing is as follows. If an individual is showing symptoms, they will be tested. If an individual has come into contact with a confirmed case, direct contact, they will also be tested. And if an individual had a significant travel history from an area that was on our travel restriction bans, then those persons will also be tested. So those are the three categories of individuals at this time that we are testing. Thank you.
The simple answer to that question, Mr. Williams, about naming the quarantine site for the general public to know, and the regulations don't provide that for us to do, and that is something that we wouldn't do, because at the end of the day, it's a matter of protecting everyone.
thank you, Mr. Samuel, and thank you, Dr. Carty, for your responses. There is one question here which I would invite Dr. Carty up again. It has to do with testing. Someone asked, has there been any underreporting or inconsistent testing in the Federation? Von Radio. AG? You take that.
Good afternoon to all. We have been having consistently reports from the Ministry of Health, the team of the Ministry of Health that has been mandated to lead the fight against COVID-19. The Chief Medical Officer appointed by the state is Dr. Hazel Laws, who has done an excellent job of updating all of our citizens on a regular basis. She is the official person who not only collates, gets all the information, presents it to the public, but also informs the Pan American Health Organization as well as the World Health Organization, of which we are all a part, to have the credible and important data collated worldwide. There has been no underreporting. Dr. Laws has been a credible and important figure in our society, and we stand behind the work that she has done. She has explained, as has Dr. Carty, the processes in terms of testing and how these are then derived. The information goes off to the Caribbean Public Health Authority in Trinidad, at CARFA. CARFA sends the information back to Dr. Laws. She reports it to the country. This has been the process, and it will continue to be so. Thank you.
Thank you, AG. We have a question from SKN Newsline for Dr. Carty. What projections have been made for St. Kitts and Nevis regarding infections over the next 2 months? I would read the question again because the person is apparently asking to make some sort of estimation, but it's what projections have been made for St. Kitts and Nevis regarding infections over the next 2 months?
Based on the data that is coming out of the worldwide outlook of this virus, it is known that about 50 to 70% of the population may be impacted by this disease. It is also important to note that about 80% of those impacted by the disease will not go into severe conditions. Thank you.
Von Radio has another question. Is there anything in place to ensure that all adhere to the quarantine? How can the public know that persons who are quarantined are not among the public?
Good day, everyone. In relation to that question, I'll just have you know that we have a quarantine compliance unit who is actively engaged in going out to the different districts to ensure that people are adhering to the quarantine measures and signing that contractual arrangement. To date, well, I think Abdis would already give the numbers, but we actually have teams right there, right now, out in the fields, in the Middle Island, Old Road, essentially constituency 4 and 3 areas right now doing their sweeps. As they come in, they would report. What they're expressing is a high degree of compliance in most cases. There are 1 or 2 where they're having problems locating individuals, maybe due to addresses and stuff, but we're seeing a high degree of compliance rate. There are some people who have a concern to us already, and that is being noted and logged for further action at a later date.
This question is from myviewnews.com. The periods of confinement, that is the curfews, are designed to help stop the spread of the virus. However, how much of a risk are the periods of public movements to the gains made during quarantine? AG, would you take that? Did you hear the question? Yeah.
There are a number of questions that are being asked as to the management of this COVID-19 pandemic that has impacted the entire world. We welcome all questions that are being asked. And the answer that we will give you is that since January 27th, to be exact, there has been a national working group drawn from a wide cross-section of government agencies. These agencies have prepared, have planned for the eventuality that we somehow will get one case of COVID-19 here on St. Kitts. Once we have gotten one case, that case could then increase to others when we have allowed have they been imported into St. Kitts. The basis upon which the task force advised, led by the health professionals, has operated is to try to stem and stop any local transmission, any community transmission. We have to be exceptionally careful that we have our people abide by keeping distance, physical distance, social distance from each other. And as a result of that, there has been put in place more restricted regulations so that people do not come into contact with each other as often. We have now got to the point where we have gone to fuller restrictions, to wit, the total lockdown. Strict restrictions will continue so as to prevent the local and community transmission of COVID-19. These will be done as long as there's a state of emergency that has been brought into force under the Constitution. This will be done as long as there are regulations that manage how people operate under those that state of emergency. And we appeal to all citizens to comply with the regulations. We appeal to all citizens to follow the guidelines, the dictates set out by our security forces. The Commissioner of Police and the security forces will enforce those regulations, and those who breach them are subject to be arrested and charged under the law. This is a very serious pandemic in our country. We expect all our citizens to do their part so as we can protect each other, our families, and our country. Thank you very much.
Thank you, AG. We have a question from Mr. Abel from Win FM, who has asked, have all the people who travel into St. Kitts and Nevis been monitored, especially those with a history from the US and UK? And he's talking for the month of March.
Good afternoon, all. What I can say from an immigration standpoint is that all of the persons who are still on island are being monitored from the US, from any other country that came in during the month of March are being monitored. Thank you.
This is a question. What type of treatment is given to persons in isolation who tested positive for COVID-19? That's a medical question, what type of treatment is given to the persons in isolation who tested positive for COVID-19? And the second question, what support is given to persons who have been quarantined or isolated, considering that close contact and interactions with close family can cause transmission? Dr. Carty.
Okay, for cases in isolation, for those persons who are asymptomatic, there is no treatment currently for COVID-19. So nothing is actually being given to those individuals. However, persons who have symptoms such as cough or fever are actually given anti-cough or anti-fever medication. Okay, so we are treating this for those persons with symptoms. We are actually just treating the symptoms, but not the actual COVID-19, as there are no treatment available at this time. As it pertains to the protocol that is in place for persons in isolation, some of these persons are isolated with other family members, and so they are able to take care of themselves. For persons isolated in a facility, then provisions are made for those persons via the government. Thank you.
AJ, I would invite you again. MyView.com didn't think that the question was properly addressed. The question was, the periods of confinement are designed to help stop the spread. However, how much of a risk are the periods of public movements to the gains made during quarantine?
Could you repeat that question, please, for me?
Yes, AG. The periods of confinement are designed to help stop the spread. However, how much of a risk are the periods of public movements to the gains made during quarantine, quote unquote?
There is no public movement during quarantine. That's why someone is quarantined. If you are quarantined, you should stay at home. There is a mandatory quarantine. If that is broken, you'd be put in a public quarantine. You should not be moving around at all once you have been designated to be in quarantine. Gains or no gains, that is not allowed. If somebody breaks that, we will have them restrained. We have provided police officers with gloves, masks, they have gotten sanitizers. And so the question is, will those law officers who have to restrain them be protected? We believe so. Quarantine is of two types. One, if you have been to a hotspot or traveled in an area that is designated to be one, you come here, you'll be asked to be quarantined. If you have become infected, some 9 people have been confirmed, you move from being quarantined to be isolated. You are sick with COVID, and that isolation means you should not come into contact with anyone who has not had that. If you are isolated, you are under strict separation from everybody else. There should be no travel or mixing with the general public and others. Let us be clear. This is to stop the spread of COVID from those who may have had it to those who do not have it. If you have COVID, you should not be in contact with anyone. That is not a question of moving around.
AJ, I think to add to what you were saying, I think the person really wanted to refer to, for example, now that we have a sort of a grace period with the curfew, and you have people going to the supermarkets, for example, some people are not practicing the social distancing protocols, which can hence cause, the transmission of the virus.
Let's be clear. People have not been quarantined. There has been a curfew where people should stay at home so they do not come into contact with someone who may have had COVID, because it's not a disease that is detectable unless properly tested. And the idea of the curfew, the lockdown, is to find a way to separate people who are safe, do not have it, from those who may have it. You look good, you feel good, but may have been a carrier. The lockdown is to prevent mingling with others. If it is that there is a partial lockdown, a partial curfew, partial restrictions, to allow those who may need urgently to get medicine, medical relief, who need to get some food to sustain them, then you come out from your home. It is not supposed to be a line. If you have already shopped and you have food, the basic necessities, there's no need to shop every day. You should stay at home. No one is going to police you to go in your house and see what food you have. But to go to the shop to pick up some nuts or snacks, that is not living up to our responsibility as citizens. We do not want to have congestion for those who need to go. We do not want to be able to be part of the mix and spread this virus, inadvertently or otherwise. Please, we appeal to everyone to stay at home unless it's absolutely necessary to leave your house. Whether there's a total lockdown or not, the partial lifting of restrictions is to allow for those who are desperately in need of having food or medical supplies to come out. It's not for everybody to say, it's a breather, and we come out. It is undermining the fight against COVID. Our health team, our nurses and doctors who are on the front line, they need your help to fight this virus. It is not for us to come out and see who gone out to shop and let me go to see. If you have food in your house that can carry you for a week, for days, there's no need for you to say, I go in by the shop. If you have to go, you have to go. But it's not for us to be experimenting. We are, as it was, not living up to our civic responsibility. It's a duty of every citizen, country above self, to fight to protect all of us. Thank you.
Thank you, AJ. I think that answered the question that the person, yes, they indicated that. SKN Newsline, at what point will authorities know that the state of emergency has achieved its aim, and what happens after?
We are guided by our health professionals. The Chief Medical Officer has the responsibility for public health in our country. She determines, in consultation with health professionals, there is a broad health team that meets regularly. Just as how we have the National Emergency Operating Center, there is the Health Emergency Operating Center that has been established some 2 weeks ago. and it meets regularly. All of the top professionals, the medical chief of staff of the JNF Hospital, Dr. Cathy and others, Dr. Liddy, the community-based physicians, all are in touch and feed into this Health Emergency Operating Center. They look at the trends, they look at how many physicians, medical practitioners who visit those who may have some symptoms, not feeling well, who may recommend testing. Those are constantly in touch with the Health Emergency Operating Center. They will see when it is, after a period of time, that we are not getting any positive results. I am not a health professional, and we expect to get that recommendation, that advice, from the Health Emergency Operating Center. The government will go with that advice. We expect it to be proper. It has been, and we stand behind our health professionals. Thank you.
The questions are coming fast and furious, which means that, you know, people are concerned. But what assurances health officials have received from CARPHA that there will not be a shortage of chemicals to test for the virus? That is in light of an announcement that they have substance to test for the next 3 weeks.
I cannot speak for CARPHA. The Caribbean community, CARICOM, has mandated CARPHA to be the official testing facility for our countries. What we have in St. Kitts is a local testing lab that has test facilities as well, that we do dual testing. We test here, and we send off to CARPHA for verification. So there is an indication when our local lab tests. We believe, as advised by our health professionals, that after a certain number of these tests correlate to those of CARPHA, that there is no difference between the two, that we can eventually come to rely our own testing capabilities. At this point in time, we test locally, we send the test to CARPHA, and when CARPHA returns those tests, we have an official confirmation as to testing. We believe at this point in time, we have sufficient testing capability to manage our situation in St. Kitts and Nevis.
I wish I was a medical doctor to answer some of these. But a question here, is the lack of symptoms the only way that is being used to determine if persons have recovered, or are these persons treated to ensure the virus is no longer in their bodies? That's one question. The other question, if essential workers are allowed to shop between 8 a.m. to 10 a.m. when the curfew is off, does this mean that they are exclusively allowed to use the supermarket without having to mix with the general public? And the other question, what kind of restraint has the police been authorized to utilize? So one is for the police, one is for Dr. Carty. Dr. Carty.
Thank you. For persons that have been confirmed as having COVID-19 and are in isolation, at the end of their isolation period and they are showing no symptoms, these persons are retested, and if that test comes back negative, those persons require still another 14 days in isolation before they are let into the public. So and then they are also tested again at the end of that 14 days. So there is a standard protocol that is being used to verify that these persons no longer have the virus within them before they are let into the public. Thank you.
Good afternoon again. I must say these are very challenging times for the police, and in effecting an arrest, the police must ensure that all safety precautions are carried out. Number one, all of our officers are equipped with gloves, with masks, and sanitizing equipment. And if we have to make an arrest for a serious crime, of course, we will utilize all the resources available to us to carry out that arrest. For minor breaches, we would prefer not to come in contact with somebody, so we prefer to proceed by summons. But if we have to carry out an arrest, we indeed have our jobs to do, and we will utilize all of our gears that are assigned to us.
AG, the other question was for you. If essential workers are allowed to shop between 8 a.m. to 10 a.m., when the curfew is off, does this mean that they're exclusively allowed to use the supermarket without having to mix with the general public?
I'm not sure exactly what that questioner is asking. This is a matter for the supermarkets. We expect that from time to time, yes, an essential worker will need to go to a shop, and that goes to usage. If there's just one essential worker who wants to shop, it doesn't mean that he alone is going to be in the shop. Others who are lining up will be allowed in. Similarly, a senior who comes to a line, normally at the early beginning, 8 or 10, but at any time, should be given preference over others because we understand that they should be given pride of place at a time when they have certain susceptibility to picking up COVID, and we want them to be at home as quickly as possible. But it does not mean that if you are an essential worker, only essential workers will be in a retail facility between 8 and 10. It depends on the number of people who want to utilize it. And again, I must stress that people should stay at home, and it's only where it is essential, is necessary, of utmost necessity that people should be venturing from their homes to get medicines or food. Thank you.
And this is our final question for this briefing. How will the resumption of commercial air traffic affect the lockdown and the attempts to control the spread of the virus?
Again, we do not know. We do not know when there will be an abatement in the pandemic. We see from the news in North America that they have not reached their peak yet. We see in the news that airlines are having difficulty and will have some difficulty. What I will say is that St. Kitts and Nevis, our ports are closed, and they will be so until we get a green light from our health professionals, advice from the working group and security forces, those who have been given the mandate to protect us, all of us here. We would not want to open up our ports to have more imported or potentially imported, potential patients coming in to affect our citizens if and when we are clear that we do not have the virus, we have the virus under control in our shores. We depend heavily on international commercial traffic, but our first consideration has to be the safety and security of our people. When we are sure that that has been achieved, when we can put in place screening and other facilities to make sure that we continue to be safe, I think we can then better answer that question. At this point in time, we do not know.
Okay, and there we have had it for our answers to the questions from the press. Thank you very much for the questions that you would have posed today, and I hope that they were adequately answered. Now, of course, the most important thing that we have to remember, and it's coming out of this daily briefing, is the importance of saving lives. We've had the postponement of very huge events, the Olympics in Japan, the Wimbledon in England, cricket, football, and so on. And that is the objective. Everything cannot be about economics. Everything cannot be about money, because you cannot put a value on a person's life. And this pandemic, as bad as it is, some positive things are going to come out of it. And there is one positive thing already coming out of it. There is a reduction in carbon emissions. So the environment is sort of a happy. Less cars on the road and less aircrafts in the air and all of that. And they were supposed to have the COP26 climate summit. That too has been postponed because of they want to safeguard lives. I want to thank Mr. Satney from the Chamber of Industry and Commerce for coming and sharing with us that there's no need to panic because we have an adequate supply of food for the next months. ACP Adolf Adams for sharing with you how the police is working with the public. It is not an antagonistic relationship. It is not one where the police is exerting force, because the police as well is just as much concerned about you and about your life and all of that, just as much as they are concerned about theirs. And they are risking themselves to make sure that they safeguard your life. So you owe them some sort of respect. And Dr. Carty, who would have shared with us the statistics in terms of the situation report with respect to COVID-19. And the officials from SAGICA who made the presentations to the police and to the to health, to the Ministry of Health, they are to be appreciated as well. And of course, Mr. Abdias Samuel, who is the director or who is the head of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA. Thank you very much for listening to us. We continue to urge you to be safe, to practice social distancing, to wash your hands as often as possible, to wear a mask wherever you could, and so on, to safeguard your life and the life of others. Tomorrow we will be back for another NEOC COVID-19 daily briefing. Until then, take care.